The very next comes the training of these investigators. The training in ICH-GCP and other aspect of the clinical trial, but also, and it is not enough to have them trained during the site initiation visit. Unfortunately, sometimes these investigators at the site initiation visit, they come, they say hello to you, go back to the cath lab, go back to their OPDs, and then come back to you on the next day, not even the same day if you have 2 days site initiation visit. So, and then they're a great host, but what we need to really insist is that we will not initiate the site if the investigator is not available per se, because that's a very commitment which we expect these investigators to give, and not the name, because it's high time we don't use, and that's why as a CRO when we are going, and as a matter of fact sponsor of the CRO, we have started looking on the investigators who are not only the KOLs or the people who are having a name in the industry, but the young investigators who are trained, who are willing to give time, and who are willing to commit their time and commitment to the clinical trial and the subjects they enroll. So training is one. The protocol compliance, depending, if you have a good investigator, you have been trained, comes the protocol compliance. I think the waivers should be absolutely a no-no for any clinical trial. There shouldn't be any waiver shouldn't be given. Amendments are also reflect badly on any protocol if there are many amendments. So you need to we need to definitely see that when there's a clinical trial conduct, it doesn't have many amendments unless there's something to do with the subject safety which comes into mind, and there's a change in that. Protocol compliance, as I said, is if there is any during the monitoring visit, if the monitors, for example, finds that there are compliance-related issues, I think they shouldn't be trigger happy, but we encourage them very much that they should put the enrollment or screening at hold. And it should be informed to the ethics committee that for what reason you're putting the screening or enrollment on hold, and any I would say active participation in the trial, retrain the investigator and then only go ahead, or allow them to go to do further clinical trial or further enrollment in the trial. So that is one thing is very clear, that you need to speak to the investigator if you have any concern at the site level, put the site on hold and inform the ethics committee, and if needed, depending on the requirement, if it has to be informed, you can inform during the drug control general. You need to change the site, or whatever extreme steps are to be taken, you need to take that, but don't be bullied by, that's what we have been doing, that don't be so-called bullied by the investigators just because of the stature in the medical or surgical field. Because the safety of the subject is important, and sometimes it is just, I'm not saying misconduct, but the simply lack of time and commitment to the clinical trial shouldn't affect the subject safety. So we need to ensure that these investigators are taken off the clinical trial if required so. The very awareness of quality works, or how everybody in the team will work in a way where there's first time right. All the documents, how everything is in place. The investigator should have time to look into every consent form. He should be part of the consent process. He should be signing, doesn't have to delegate everything to the sub-investigator and so on.